Hello, good afternoon, everyone. Thank you so much for joining me today. I'm 𝐝𝐶𝐭, self-care strategist for female entrepreneurs specializing in systems that transform daily stress and constant overwhelm into clarity and calm, while also creating space for personal fulfillment. And today, I have a special guest joining us to help us understand the differences between stress and burnout. I know there's a little bit of differences. I'm thrilled to welcome Dr. Vanessa Vélez, a holistic and integrative board-certified psychiatrist and psychotherapist. Dr. Vélez is the founder of Soul Psychiatry and has extensive experience in helping professionals manage stress and burnout, amongst other things that she does. She graduated from Cornell University, 𝐤𝐬𝐬, Commonwealth School of Medicine, and Hackensack Meridian Health Psychiatry residency. She dedicates her time to helping young adults and adult professionals struggling with depression, anxiety, trauma, ecological, existential, and spiritual distress, and find inner peace. She combines modalities such as psychotherapy and medications with holistic approaches, focusing on spirituality, creativity, and purpose. She's also, which I love this, she's contributed to different articles talking about her expertise. She's contributed to the Psychiatric Times and Kevin MD, and she's made appearances in the media, including Univision, and collaborated with the American Psychiatric Association, speaking in Spanish on PTSD. I'm extremely excited to have our guest join us today. So welcome, Dr. Vélez. Thank you for carving out time to be with us.
Oh, thank you, Leslie. Thank you for having me here.
Yeah, well, it's great. I love, in fact, what's really great so far too is that I have had you record with me, and your episode is going to be coming out in September for the Young Professional series. I'm really excited about that because what you're doing is you've got incredible work that you're doing. So I just want to put that out there for anyone who, after they listen to this, like, I want to hear more. You're going to get that chance. So today, Dr. Vélez is going to help me answer some questions around stress and burnout. I truly believe, even though I know that our chronic stress can lead to that burnout, I know that some stress is good. So first of all, Dr. Vélez, in your opinion, can you explain what you found from your experience in what you do? What is stress and how does it typically manifest in people?
Yeah, so stress is a normal reaction to everyday pressures. It's the body's and mind's response to a new event or challenge. And like you said, there's this optimal level of stress that helps us with peak performance. So we're feeling focused, motivated, attentive, interested. When we have low stress, we might feel unmotivated, tired, lethargic, bored, unchallenged. When we have too much stress, we might feel overwhelmed, kind of in the state of fear, paralysis, or even anger and panic. And so when we think about stress, it's just the way the body and mind try to adapt to a challenge. And that those immediate changes, there's the fight or flight response, the sympathetics kick in, so that we can really raise to the occasion of this perceived threat. So a lot of times our bodies pump out adrenaline, so that we can breathe better. Our heart rate increases, our blood pressure. We get a little bit more glucose, so we have more energy. And then we also have the hypothalamic pituitary adrenal axis that floods our body with cortisol so that we can have more energy as well. So it's a really beautiful system that happens so that we can back in the day, it was really to fight a tiger or a bear or whatever it was. And now it helps us meet deadlines. The issue is when that nervous system, that sympathetic is always on, that leads to that chronic stress.
Yeah, no, I appreciate that because there are good stresses, but I feel like we have this word stress, and everything negative about stress is what we put on it, and rather than looking at it from the positive. So I'm glad that you talked about that. So how does burnout differ from stress? Like, what are some key indicators that someone is actually experiencing burnout rather than just high levels of stress?
Yeah. So burnout is defined as chronic or prolonged response to stress in the workplace. And there's physical, mental, emotional. It's really a state of exhaustion. And there's three features that really you can tell whether it's stress or burnout. The first is just overwhelming exhaustion. There's just this depletion of emotional and physical energy. There's a loss of motivation, commitment. There's also cynicism and detachment from the work. So you might start to feel a little bit more pessimistic, a little bit more negative, callous. In medicine, we might, if we're in burnout, we might have this dehumanized sort of way about us, that we just see the person as an object or a customer versus a patient or a human. And that's just the way our body and our mind tries to protect us from intense emotions, from getting, hurt morally at work. We also might feel depersonalized, so meaning we might feel detached from ourselves. We might just be feeling like we're going through the motions, almost like a shell of a person. There's a sense of apathy, I just don't care. I just don't have the energy to care. And we might begin to become ineffective or inefficient, and then also have feelings of incompetence and just not feeling like we're achieving our goals. So those are some features of burnout. And then also there's physical symptoms, like we might start having like more headaches, muscle tension. A lot of times it's in the neck and the back. We might have physical pain, joint pain, fatigue. We might not sleep as well. It might be hard to fall asleep because we're just in that constant worry mode. It might be hard to stay asleep. That's another manifestation of that burnout. Our bellies, we might start feeling more constipated or have more diarrhea. So that's our GI tract kind of gets affected. Like we mentioned, we might have more anxiety, irritability. It might lead into the realm of depression, even suicidality, difficulties with concentrating, memory, changes in appetite. We might also be looking for quick fixes to feel better. So we might be reaching for more alcohol, cannabis, overeating, undereating, all of those things. And even like nervous thing, like nail biting or pacing, grinding our teeth, heartburn. There's so many different symptoms of that true burnout versus stress.
Yeah, I love how you brought up all of those different symptoms, because I think a lot of times people look at symptoms and they're not necessarily realizing that it's the chronic stress that led to the burnout, which has now manifested in all of these different things, the emotional sides to it, the mental sides to it, and then when it starts to really physically manifest itself, like I've talked a lot about, I had my very first, when I went back and actually started looking through my life, because I feel there's clues in our past. I found my very first real experience around burnout was in my early 20s. And I felt like I was able to maintain a high level of productivity. I was go, go, go. I felt I had the energy. And when we're young, we feel like we have the energy. However, I kept at it so long, for such a long period of time, that it caught up to me and started to manifest itself first within a panic attack. Then my body started to really manifest symptoms, like I became lactose intolerant. I developed hives, and I realized now it was just my body saying, okay, enough is enough. I've had enough. I can't take anymore, but not recognizing it. So I love that you brought that up, because a lot of the time we are not looking at those particular types of things, like especially the physical side of it, as burnout related. We're looking for other things that could be causing it, but other things could be part of it, but not necessarily the cause of it. And that's why I wanted to ask you. There's a question that I know I didn't really submit this to you, and I like to submit questions in advance, on specifically for these types of interviews, because I really want your expertise to really shine here. I know that you're very well versed. My question is around stress. Like I'm reading a book by a Dr. Aditi Narakar about the 5 resets, the five mental resets or the five resets. I forget the name of I'm now butchering the name of the book, but it's basically about, she talks a lot about stress and burnout. It was just dropped this past January. And one of the things that she was saying was that there's really such a high level of doctors not necessarily talking about stress more with their patients. And I'm just wondering, do you feel, if it's just in your opinion, and I'm not saying it's right or wrong that what people do, but do you think people are more looking for things that they can see that are really causing the burnout rather than talking with their doctor about like the things that they don't know that are actually contributing to their burnout?
Yeah, that's a great question. I really believe that, we can only go as far as we've gone ourselves. And so, meaning like medical culture, it is very, very strenuous and sometimes even toxic. And so there is this sense of doctors, medical students, even pre-med students, we have to ignore our own intuitions, our own body needs, our own values a lot of the time. So we are taught that there's this sort of badge of honor if you've pulled an overnighter to study, or you did a 24-hour shift, or you didn't pee for so long, or you didn't eat for so long. And so it's getting hopefully a little bit better that we're talking about this more, but there is a lot of burnout in the medical field. And this burnout is also contributing to 400 suicides in the medical field by doctors. And so we are really not taught to take care of ourselves. And so there is this pressure to just pull through, just keep pushing, this mental toughness, or that you're weak if you ask for help or if you take care of yourself. And there's a lot of push to, on the individual level of like, oh, okay, well, just get a massage or go to yoga or do some mindfulness. But really, we need like a culture shift. We need an organizational shift. We need people in leadership to speak to doctors that are doing that patient care and seeing what their needs are. And so I really think it starts with the health of doctors to be able to really empathize and to care for patients and ask these questions about, what's going on, what's the stressor in your life. And there's so much, right now I'm also working in a community mental health clinic, and there's so much financial stress, there's transportation stress, housing stress. And so there are a lot of different factors that come into play. And then on the doctor side, like a sense of like helplessness, because, I can't really do a whole lot for the housing piece. And so it's a really great question, because I really think that the answer lies in getting doctors to be healthier and medicine as a whole to be healthier, so that we can ask patients about their stress, what's going on in their personal life and their professional life. Yeah.
I love that answer a lot because, last week I did talk about that, how burnout, it does actually, it spans all of the industries. It's not just like one particular field. Like everybody is experiencing it, whether it's teachers, doctors, nurses, people in the legal field, whatever field you're in, you're going to feel it, whether you are a professional. And it could even be even our kids. I spoke with a couple of teachers who talked to me about how, not only was it affecting them, but they could see how it was affecting the kids with the workload, with the educational load on them. Now it seems to be even more. And there's no real like talking about it, that there's that stress. I think it starts off with that stress level, which becomes chronic, which then that does, turn into that burnout phase. So I love that you talked about that, because it's not just, I really feel what you were saying is that doctors need to be able to be okay with talking about it amongst themselves, take care of themselves, so that they can be more open with their patients about that, because it is affecting them as well. And that's what Dr. Aditi's book is also about, is that her as a medical professional, she also has acknowledged burnout has been a part of her life as well. So, and it is part of the profession, and something that, needs more notice. So I appreciate that. Thank you.
Mhm.
So what do you think are some common misconceptions about stress and burnout that you encounter in your practice?
Yeah, like we've mentioned, this idea that all stress is bad, it's actually really helpful. And it helps with performance and focus. Like you also mentioned, that's only work related. There's so many students, caregivers, parents, it's not just work at the workplace. There's so many ways to define work as well. Often, that we think that it's a sign of weakness, or I'm not tough enough, or I can just push through. A common one is just, it's like a quick fix. Oh, this is just a phase. I just need to yoga my way through it, or it'll go away on its own. But actually, we need to look and ask those really big questions and deeper questions, so that we can have a sustainable lifestyle and mindset. So those are some common misconceptions.
Excellent, thank you. So can you share some examples or maybe even cases, without obviously giving away names, where that distinguishing between the stress and the burnout has made a significant difference in the treatment of a patient or the outcome of whatever the outcome was they thought was never going to happen, but it did happen?
Yeah, so it's really interesting because sometimes we use these words like very colloquially. We'll just be like, "Oh, I'm so stressed out, I'm so burnt out." But what is it really? Is there apathy? Is there cynicism, depersonalization, ineffectiveness? What's actually going on? And so sometimes patients might use these words to not take ownership or responsibility for their lives and say like, "Oh, I'm just too burnt out." But like maybe, it's interesting. These words, I don't really love the failure to launch or the Peter Pan syndrome, but it gives us a little bit more of an idea. Carl Jung talked about pure eternus, or puella eterna, meaning a child God who is eternally young. So someone who's older and prolonging childhood and not making those decisions about work or responsibility, ownership, authority. And sometimes, that can come from having a narcissistic parent, but we need to talk about empowerment. How can I feel empowered to tolerate frustration, to be able to be resilient and adaptable, and take on responsibility. So that's been helpful. Some people don't like to hear the truth around that because it's hard to take responsibility and ownership, but that is helpful to think about. Is this stress? Is this burnout? Is this just a lack of motivation and empowerment? Another example is, people in corporate medicine or in big law trying to make these big decisions of, am I aligned? Are my values aligned with my work? Like, what is my why? Am I engaged? Am I feeling dedicated? Do I immerse myself in my work, feeling like enthusiastic? Is it meaningful to me? And I like the Japanese concept of ikigai. I can never pronounce it. 𝐤𝐼𝐾𝐼𝐺AI. Ikigai. But it's basically the crossroads of what I love, what I'm good at, and what the world needs and pays for. So those are really great questions of like, yeah, what do you love? What are you good at? And what does the world need right now? And can you actually, how can you pay your rent with that? And so something really nice to do is a decisional balance sheet of, well, what are the pros and cons of staying, of changing, and that helps us see which ones are pulling us a little bit more. And then also looking at that degree of job mismatch, like what are my values and what is my work environment? Is the workload too much? Do I have a sense of accountability and responsibility that I'm able to really contribute? Am I getting enough pay, acknowledgement, appreciation? Is the workplace Is there a sense of community? Is it toxic? Is it malignant? Is it a place where I feel comfortable and there's a sense of happiness and humor? Is the workplace fair? Is there favoritism? Is there unfairness going on? Is there moral distress and injury? Am I having to make decisions that are going against my morals? Like an example could be in the ICU, trying to prolong someone's life, or someone who's 98, for example, and there's, it would be amazing if they could have a peaceful death, but somewhere along the way, maybe through communication or family wishes, we're still doing CPR, or they're still on a ventilator, so prolonging life, and that may go against our morals. So how do we really address those mismatches in our workplace? That's really helpful to be able to guide people through those life decisions in my practice. Because a lot of questions are, should I stay, should I go?
Yeah. Because asking the hard questions, being okay to ask and brave enough to ask those hard questions. I feel like when we allow ourselves to just step outside of what everyone else is going to say or think about us asking that particular question, either we stay stuck and we never know the answer and we're frustrated, or we at least just allow ourselves, even if someone doesn't like the question, we ask the question anyway so we can get an answer that will help us to make our own decision, because that's the only way we can live our life. If we have to ask questions. And I think a lot of the time too, we can find those clues from our past. Like some of those questions that we ask ourselves could be influenced by what we experienced and how we allowed those experiences now to answer some of those questions for us now, when we can actually make changes. So I appreciate that you brought that up. Thank you. So what are some practical steps that someone can take to manage stress and prevent burnout in their daily lives?
Yeah, so there are some steps. I always like to think there's those steps in the individual level, and then that organizational, cultural, societal level. So it's important to remember that those are, two important pieces. On an individual level, we can really set time boundaries and work on time management. But even before that, I just want to say, recognizing. I think it's so important to recognize where we're at in that stress burnout continuum spectrum, and to acknowledge it, to give ourselves space, to have that compassion and that courage to really get intimate and close with ourselves, with our needs, our values. So I think that's really important, is just to recognize, acknowledge, investigate, nurture. That comes from Tara Brach, the RAIN meditation. Recognize, acknowledge, investigate, nurture, and then work on the things that we can control. What can I control? I can control my time boundaries. I'm not going to respond to this email. I'll work on charts tomorrow. I'm going to advocate for myself. I'm going to tell my boss, what I need. And if they're not able to accommodate, then, what is in my control? Also taking care of the basics is really important. So prioritizing sleep, because there's a lot of benefits with sleep. We get to rest and recover. And watching out our caffeine intake is really important, because sometimes there's that afternoon sort of slump after lunch and we want to grab that coffee. I see a lot of patients drinking energy drinks or even teas, and they don't really know that black tea, green tea has caffeine in it. So making sure that if we do drink caffeine, it's early in the morning. Looking out for our nutrition, eating fruits, vegetables, things that aren't going to inflame our nervous system and our body. Maybe less red meat. Also, movement is really important. A lot of us sit down all day, so trying to sneak in those, 10-minute walks, or if you have to go to the water cooler, go maybe a little bit the longer way, or the bathroom, maybe go a different, the furthest bathroom. Having that meditation practice is so important in the morning and right before going to sleep, just to ground down in the present moment. sort of acknowledging like, what's my energy today and what are other people's energies that I'm going to encounter? Because sometimes we go into our workplace and all of a sudden we're feeling anxious and we're angry and we're like, wait, where did that come from? I wasn't feeling that earlier, but we just absorb things. We're kind of like sponges. So being able to recognize, okay, this is how I feel right now. And then checking in within our, checking in throughout the day, just for, 5 seconds or 5 minutes, closing our eyes. Maybe if we're in an office, turning off that light and just, deep breathing. That mindfulness is so important, coming back to the present moment, because when we're in the past, we're in that depression, that regret, the guilt, the what ifs. What if the past would have been different? And then when we're in that anxiety mode, we're looking in the future and we're trying to prepare for perceived threat. We're trying to predict the future. So just coming back to the present moment. In this moment, I'm safe, I'm protected, I'm supported. Support groups are really important. For physicians, there's the Physician Coach Support Group by Dr. Diana Londoño. There's Physician Anonymous. There's IDAA for physicians and healthcare workers with addictions. So finding that support group is so important. There's so many self-care things: yoga, massage, acupuncture, noticing our thoughts, unhooking from those thoughts, those fears. And then just, there's that compassion and kindness, just coming back, because a lot of times we have that inner critic, and that, oh, well, I should be keeping up. I should be, doing what so-and-so is doing. I should be cranking out all of these, abstracts or conferences or research or, productivity. And a lot of times we're driven from the sense of unworthiness, a sense of I'm not good enough. If I do this, then I'll be worthy, I'll be praised, I'll have the sense of accomplishment. So sometimes we need to sort of detach from that and integrate this sense of self that isn't tied with productivity that, our capitalistic consumerism society really pushes on us. Like, who am I really? Am I this body? Am I my mind, my thoughts? Or am I something that's greater, this divine presence, this love, this compassion? So yeah, there are many things that we can do, and noticing, our stuck points and how we can grow and evolve.
Yeah, no, I love that. You shared quite a lot, and I'm hoping that the listeners or the people who are watching are, getting a lot of value from that, because there's just so many things. Self-care is everywhere. Everything that we can find so many things to help us. But I love the fact that you were talking about the past and the future. That's not those things. Yes, they matter in the sense that knowing where you came from and knowing where you want to go. But if you're always focused on those things and you're not focused on what's happening right now, those things are going to really take up a lot of your time and your energy, rather than just being focused like right now, like what you're doing right now, like where you're at in your life right now, and being okay with that. So thank you so much. So before we wrap up, can you share a little bit more about you and what you find most rewarding about the work that you do?
Yeah. So right now I have my private practice, and I just love it because I get to really be able to spend time with people and work one-on-one and see, what are the root causes of the symptoms, and not just be like, well, here's a pill and see you in 3 months, but really like what's going on. So I just really enjoy that. And I'm also working at a community mental health clinic, and it's really like it's really beautiful work, and also really challenging, because there are so many things that are out of my control, but it's an opportunity to see what is in my control and to be present with someone and to be able to listen, and in this very non-judgmental, compassionate way, where they feel like there's so many times where I've heard like, oh, I've never said this to anyone, or I just feel so comfortable with you, or so I pride myself in giving people that opportunity, that cocoon, that space, so that they can be themselves, they can release, their inner workings, and also provide them with tools that they can use. In community mental health, a lot of folks are, because of the not having enough resources, money, they go to fast food, they're drinking a bunch of soda. They don't know much about the caffeine and energy drinks. So it's really cool because I can talk to them about these small things that could make big changes. Diet and nutrition and exercise and movement, and in the private practice, just be able to dive deeper. I really love providing therapy. So in that space, I'm able to talk to folks, inner child, art, parts work, and that healing from the inside out, and showing and telling people, like, you have all the answers. I'm just here to be a guide. You are your own therapist, your own psychiatrist, your own healer. But sometimes we need someone who's a little, maybe 1 or 2 steps ahead, that can tell you and help you navigate. So it's really, really rewarding work, both the private practice and community mental health.
Yeah, no, I love that. And I think too, with what you're doing is allowing them to understand that, yes, you have the answers. I'm here to guide you. And like you were saying, sometimes we just have that mental block. That's why even myself, I get coached, because I know that I'll have those mental blocks. I might have the answers, but until someone helps me to get through it all, to wade through all of the muck that's kind of keeping me stuck, that's where I feel like asking for help is really important, and finding someone like yourself who looks at it that way, that yes, you have the answers within you, let me help you, guide you through it, and help you bring down those barriers that are keeping you stuck from actually seeing the answers. So I appreciate it. Thanks so much for spending time with me today. I am really, really excited that you came on and share your expertise. It's really been incredible to get your perspective around stress and burnout, because I know there are differences, and giving us some effective strategies to manage them. I also want to thank our audience who've joined us live today, and for those of you watching back, I hope that you've all learned something to help you further really reflect on your own self-care. And I'm going to leave you with some questions, just a couple of reflective questions, because I think it's really, really good to consider, where we're at when it comes to stress and burnout, knowing the differences. So the first question is, when it comes to stress, how do you currently manage it? And are there areas where you can improve your approach to it, especially if you have found yourself burning out? And then what steps can you take to better support your well-being and ensure that you're not just managing stress, but you're also thriving in your personal, professional life? I hope that when you reflect on these questions, that they help you identify the areas not only where you are doing well, because you also want to be able to focus on those things and say, yes, do more of that, but possibly where you can make some changes, some positive changes, and take proactive steps towards that. So thanks again for watching. Thank you, Dr. Vélez, for being here. I am really excited that you said yes. Really thankful. Thank you. Thank you so much. And also for all of you out there, don't forget to join me next week at our usual time on Wednesdays at 12:15 Eastern. Until then, take care, and remember to prioritize your well-being, because you matter.
Thank you, Leslie.